hello everyone. Thank you so much for joining the Center for Justice and Law's Spotlight Conversation series, where we talk about topics on health, justice, and law with guests. My name is Raina Meyer. I use she, her pronouns, and I'm a student coordinator at the CJL at Hamline University. This is our second Spotlight conversation around the topic of immigrant and refugee health. And our conversation today will be with Ruben Dominguez. Ruben, thank you so much for joining us.
Raina, dude, just thank you for the invite. I'm super happy to be doing this with you.
Yeah, well, I'm really glad that you said yes. I asked you to join me because I love talking about issues like this with you, and you are first of all so incredibly smart and have such incredible perspectives. And I think talking about the systems we live in, especially as they relate to health, is really interesting. And you inspire me because I feel like you think about the world in a really unique way. And I think that your insights are really valuable. And you do so much work to improve our community and really channel your intelligence and passion in a way that benefits others. So that's really inspirational to me. And I'm wondering, along that same vein, if you could tell us about the work you're doing for your community.
Yeah, I mean, I guess I'll start like at the beginning of Hamline. I mean, that's when I really start getting involved with my community in general, because before going to college, I was kind of more hands-off. Like the whole idea of being an activist felt so blown out of proportion. It was only for people who were leaders, people who had this bigger persona, and I was never that guy. But then once I started at Hamline, I was inspired by so many great people, and they kind of taught me that like caring for or taking part in your community, trying to better it, isn't really a big thing. Matter of fact, just what you do on a day-to-day basis. And like what really helped me, I think the biggest thing that I've ever done that really like opened my eyes was my internship at the ARC. And we're just like helping out these Hispanic families just navigate the healthcare system, whether their kids have a mental disability of some sort or any kind of disability, what that means as well. It's just learning that really all of these systems are working against us, and as easy as we think it might be, one simple step to even getting a bus takes about 4 or 5 days in advance to plan, and it's just this idea of like, wow, all the cards are stacked against us over what, So that's the one thing I started. And even now with the work in-house, I really want to try to improve just ties we have with our community around Hamline, because at the end of the day, that's where I grew up. I grew up with that community. I know the business owners down the street on Joe University, they're family friends, So it's all these small things I think that if I can help out at least a little bit, then I'm gonna at least know I tried my very best to do something.
Yeah, well, that is, I think you're trying and succeeding to help people. So thank you for all the work that you do, seriously. It's kind of weird to say that as like a friend, but I know you're making a difference. So I guess that kind of leads into the next question we had, which is like, where does your personal connection to the topic of immigrant and refugee health, justice, and law come from? Like, where does that passion originate with you?
Yeah, I mean, to be quite honest, it just comes from my family. Like my family first came to this country when they were just teenagers, and then I was lucky enough to be born in this country, so I have papers. That's a privilege that I have grown to understand, that that just gives me a lot more power than of my peers around me. And it's how can I use the systems I was given access to that so many people weren't. So it really comes from that, just seeing how my own privilege benefits me on a day-to-day, but I didn't really see it. But then how the systems were working against my parents. And I guess it really hit me during the COVID era. And among other things too, for example, my dad had a hernia and he wasn't able to get any healthcare. So for a long time, he was just suffering with the hernia, and it was a thing that was life-threatening, And I'm just seeing him suffer and not knowing like how can we get the proper help. And I'm just seeking out resources, contacting different orgs, like what can we do to get this man? And it wasn't until finally we found a plan that was able to help him out. But it just goes to show that throughout this entire time, my dad was almost dying basically. And how was I, as his son, gonna watch him do that just over this paperwork? It's so meaningless at the end of the day, So when I saw that, like that's kind of what really pushed me into like, oh, I don't have to do anything big, as in like, oh, gotta do major reform. I just have to assist people to get into these resources that we already have. Because if we could barely find it ourselves, and and I understand English, I speak English, my older sister does, that alone is a privilege. Then how many people are struggling to find them, and how many lives haven't been lost because of that? So it's just all these things that kind of play into a role that really opened my eyes to it. So that's my own side with it, just my daily life.
Yeah, well, I feel like so many people could relate to that story of like someone's life is literally on the line and they should be able to access the resources they need, but they can't because of these massive barriers. And I guess, could you talk a little bit more about some of the specific like roadblocks you've experienced or seen that stop people from getting the care they need?
Yeah, for sure. So the main thing to just give a preface is that I'm going to speak on the Hispanic side of it, because the only side I know. I know everyone's story is very different, but this is the community that I worked with and the one that I grew up in. So I don't want to assume or say that this is a story for every Hispanic or anyone like that. This is just my view on it, the way that I give it to the world. So that's my preface to it. But a big system is honestly just immigration reform and having access to having papers or being a U.S. like native born person. Those are like, if you're born in the US versus if you're not, and if you have papers to work here and you don't, there's so many different power stances right there. So when I was working at the ARC, a lot of it was just understanding that this mom had 3 kids, worked here in the US her whole life, but she doesn't have papers, unfortunately. The odds were still so stacked against her. Her son had Down syndrome and she worked all day basically, and all she wanted was to get him a ride to school. That was it. And just to even get access to that, she couldn't do it through the state because, one, she doesn't have papers, and even if her son does, because he was underage, he couldn't file for himself. So the mom had to do it. So the mom's already being blocked off, and the son who has papers doesn't have access to do it. So then it's like, well, where do we go from here? Well, let's find out the other things. Mind you, she's also a single mom, so income's another thing right there is playing a role. So trying to find all the resources that can, like, I guess, ignore those gaps that we have and give her the right thing. And something so simple, just a bus ride, it shouldn't be a major thing. But when it becomes a day-to-day struggle, like every day she's thinking about how can I get my kid to school and get to work on time? Because if I lose this job, my family's not going to eat, And that's just like everyday healthcare stuff too. At the end of the day, even the not like resources for general information, how to get help, even for the COVID vaccine. This is a prime example. There was a lot of lack of knowledge for Hispanics because the resources weren't translated to Spanish. So we have this plethora of information that for us people who speak English, we're like, cool, everyone's kind of saying the same thing. But on the flip side, we had moms asking us, like, sorry, context, us is me and my old boss, Ryan Pasquad, great guy. But we're the only 2 working in that department. So we had moms asking us like all these general questions like, well, where can I get it? How much does it cost? Even though it was free. But they simply didn't know because they just didn't have access to information. Because no one put in the effort to think about, let's translate into the Spanish speaking community or even the simple flyer. Like we can just hire a translator, pay him his fee, whatever. But now we can mass reproduce this. People don't want to go through this extra lengths. And it's just the idea that language, income, legal status, they're all playing a role. And I don't know, like the more I get into it, the more it kind of breaks my heart that we put all this value over these meaningless papers. Like it's just paperwork at the end of the day. Oh, versus human lives. It's like, why are we having this debate? Like, it shouldn't be that hard to pay a fee to translate something into Spanish to make it accessible. But yeah, we're acting like it's a major thing. But when it comes to spending money on other things that are catered towards, and this is no offense to anyone who falls into this population, American-born, mainly Caucasian people, there's not a question about it. We're like, yeah, for sure, we'll give them the resources. So why suddenly is it a problem when it comes to people of color and people who are immigrants? Like why are we any different than them? And that's what these moms are asking us all the time. Like, why can I do this? Why can my son go get vaccinated? Why do I have to, Yeah, sorry, that's kind of a tangent.
No, literally no need to apologize at all. That was like what you just said was so important. And translation services is something that was actually discussed in the last spotlight when our guest Ridwan was talking about she was talking about how like immigrant parents are made fun of for having an accent, and like she grew up translating things for her parents, and especially in the healthcare field, that it's so difficult when hospitals don't have easily accessible translators, because it's someone's health, and it could be the difference between life and death if they don't have their English speaking child with them or something like that. So, and you kind of touched on this in your answer just now, but what are some other issues that you see intersecting with the two main ones of immigration and health that we're talking about?
I think because we're so worried about the main issues I told you about, income, wealth, and paper status, and how that affects those, it's very easy for people to kind of like ignore the smaller sides of health, like mental health. Mental health, depression, anxiety, these are all rampant in these communities. So like the parents have it, the children have it, and they're not even like, even if they're aware of it, the most general thing is I just don't have time to care about this, you know? And it's like when we don't give time to fix these issues, it trickles down to everything else, you know? So the way I see health at this point is, once again, the ARC really taught me, like, I will give a lot of credit to the ARC and all the work they do. Really great stuff, because they really, you understand, and Abati even told me that when you're touching one issue, you're going to tap into 40 others. You know, like, it's kind of like a tree branch, how like you pick one leaf, but that leaf is coming from the root of so many other issues, you know? And that's what we see here. So when we're so focused on trying to solve all these daily issues, or even with my dad, like the hernia example, you know, we didn't have time to think about his anxiety or like his kids, the way they were feeling, or their depression, or anything like that. But mental health is a concern, but because we're so focused on the bigger things, we can't address them. And oftentimes too, when we do have the time to address it, if you're privileged enough to have that level of income, do you have the means for it? Like, can you afford a therapist, you know? Like, and that's such a thing that it kind of also goes back to the culture side of it too, where, well, at least for the Hispanic, let's be honest, we have this thing of being of like this culture that doesn't really let men feel their emotions sometimes, you know, and something very common that we see, and it's not well, it's not good, and therapists in Mexico are working hard to break this idea down to let people understand that you're allowed to feel emotions, but it carries over to here and kind of runs down and through the children. So we think a lot of times we're like, well, it's easy, just go to therapy, go get help, go get help to understand how you're feeling and understand how to process that. How do I do it? You know, like how do I go to a therapy when I don't even have health insurance? You know, and like I'll speak on this for my own personal thing. For a long time in my life, I didn't have health insurance either. You know, like my parents didn't have health insurance, so how was I going to get health insurance? So how are me and my sister and my family going to worry about anything else? How about taking care of our mental health when we just wanted to live? You know, and I don't know, I feel like mental health definitely has to be more addressed, and therapy shouldn't be this prestigious thing or anything that like is behind a paywall. It should just be something that everyone should have access to, you know. And I'm happy that Hamline offers that. But once again, how much are we paying tuition? You know, we have therapy because we're paying a luxury fine for it. And not everyone goes to college, and not everyone follows their career path. They deserve help too. And that just kind of helps out family dynamics as well. I feel like it could kind of also go back to what I told you about the tree branch ideology. Like, you can't really tap into one issue and expect things to kind of solve themselves. Everything ties into each other.
Yeah, no, that is such an important point about mental health. I feel like especially too, because people don't really consider how often mental health can manifest into physical issues. And like taking care of mental health is a way of preventing physical ailments too. And you see so many times like with like social services, like physical ailments are covered in treatment, but mental health is not covered. And I think what you said about, you know, like the toxic culture surrounding, especially like men like you not feeling like you can really express emotions that well. And, you know, it's really important to not just prioritize physical health, but make them equalize physical and mental health. So thank you so much for touching on that. And
I do. I mean, sorry, I could draw off over right now.
no, you go ahead. This is your spotlight.
No, it's really more of a conversation between us. Like,
Yes.
I think that also is like even access to food, dude. Like,
Yeah.
where can these people afford? Like, where can we afford to live when you first come to America? And do you have access to fresh groceries? Can you like honestly prepare a healthy meal? And if you can, like, how much does it cost for that? Like, health isn't just about going to the doctors; it's about your environment as well.
Yeah.
And once again, it's all locked behind a paywall, and a lot of these immigrants don't have access to it. My parents did when they first came to New Jersey. We were living in a basement with asbestos in it. Like, that's not healthy at the end of the day. And once again, I'm saying from a point of privilege right now because I'm living in a house. I'm grateful to God for that every day. But I recognize that's my privilege. But how many people are still in that basement? How many new families moved to that basement after I left? It's all things that kind of just added together. And do you have access to a fresh grocery store?
Yeah. Yeah.
The closest stores to you, most of them are just fast food, and it's all catered towards like low income neighborhoods. So it's like I don't have the means of transportation to go to the grocery store and the next town over. Two, I just don't have time for it. And three, even I do have all those two things, can I afford it? I don't know, dude. It's like it just really feels like at times everything's working against you. I know we have this thing about the American dream, like about when you come to America, your life's gonna immediately be better. Dude, it's like a download time. Like, how like seeing the download bar go very slow, then it just kind of stops in the middle. That's what it is. It's like once you stop in the middle, you're seeing all these issues. Like, dang, nothing's really going for me. It almost seems. And then it comes to the question of like, we speak this big propaganda about like, yes, come to America, land of the free, home of the brave, all that good jazz, whatever. But like, what are you doing to support it? What are you doing to support it? But yet people maximize off their labor.
Yeah.
So no one cares about your health or the fact that you're dying unless they can make money off of you. And even then, you still don't mean anything to anyone in the long run.
Right. No, that is such a good point. And I think like it also leads into something I've been thinking about a lot lately is like when people say, well, we need to take care of immigrants because they do a lot of jobs that we don't want to do, like, picking food in the fields, and like they make all these stereotypes, which is that's really harmful because, and I'm sure you can speak to this too, but it once again, even if it's not intentional, places value on someone just because of the work that they're able to produce, where it's like, or what about immigrants who come here and can be doctors and things like that, but they don't talk about what about the immigrants who come here who have disabilities or who can't, who don't have the resources to be able to contribute back to society. We still have a responsibility to take care of them. So
yeah, no, and it's like America, by the way everything is set up, America just wants a certain kind of immigrant, like they want someone to be happy just working like these hard jobs and then not need anything else. At the end of the day, people only want to use immigrants all the time for their labor, and it's just not fair. And then once again, if you're in a position of power where you are accepted into this bigger fields, like being a doctor, you come to America, you already have a doctor from a different nation. That's so great now, but people don't recognize you for that. At the end of the day, first and foremost, you are an immigrant. And even if you do have everything in your favor, like DACA, great program, it's amazing. But like, there's still constant questions about it, like no one's ever wondering like, oh, I'm guaranteed because I'm DACA. That's never been something that anyone has said. There's a fear behind that because it can be plugged away at any second, and we constantly hear it on the news. So it's like, what do you want from us? What more can you get? And why don't I deserve to live? Why doesn't my dad deserve to be healthy? Like, what makes him any different than anyone else? And like, I don't know, I really tie back to him because like, you're just seeing your father lie on the ground suffering. You can't do anything about it. This isn't a cold, it's a hernia. Like, this man was facing a life-threatening condition, and this whole time you're telling me that he couldn't do it just because of some paperwork. He worked here his whole life, like this dude basically grew up here since he was I'm calling him this dude. I'm just very close to my dad, for context. But he grew up his entire life here. He worked here, and he's done nothing but provide and be a great guy. So why does he deserve this? you know?
Right.
Like, healthcare shouldn't be a question anymore, especially when people take and take from people like my dad. When he comes in and does nothing but work, but as soon as he needs help, there's a big like mystery for us to go find it. Like, why? You know?
Yeah. Well, and I think something that's really interesting too is how we have allowed this concept of health, which is, it's not even something you need to survive, but it's just being alive. Like
Yeah.
that's what it is. And we've allowed it to be commodified to such an extent where we don't even realize, like, if you're like, you get really good insurance if you were lucky enough to have a really good job, or you're paying like my parents like sky high, like sky high costs every month just in case we happen to get sick or injured or something. And it's just such a normalized thing where it's like, oh, that's part of my bills every month. Just in case I get sick, I'm paying to this entity that I never really see or hear of. But it's just commonplace, which I think is something we should address more.
Yeah, I feel like we just gotten so used to the idea that like lives are just worth money and labor, you know? Like, we're constantly put up in this debate of like, well, I have to do this job until I can get insurance. You shouldn't base your entire passion just to get insurance, dude. You know? And
Yeah.
it's like, for these people who do work these jobs because they don't have access to any other jobs, like, so the field one is what you mentioned, you know? For those people who have no choice but to work in those conditions, not because they want to, it's not because immigrants come in and think that's the only thing I want to do. No, like, first off, give them respect, give us respect, you know, like, don't view us as something underneath you to be able to use, don't commodify us. But when people don't have access to any other job and they are working there, they work there 40 hours a week, 60 hours a week, more hours a week, undocumented hours a week. Don't they deserve to live, bro? You know, like, we're putting plates on America, like, we're putting food on America's plates. Don't they deserve basic care from America? But then we just kick them out, you know? And like, especially with COVID too, the pandemic's brought into question, and if it really secluded us. Like, I remember just hearing all these parents asking me and my boss questions like, can I go do a test, or will that like get reported to the government and that's gonna leak my status? You know? And it's like this distrust we have created where it's like I can't even access basic needs because I'm afraid of what's gonna happen to me, you know?
Right.
And yeah, I don't know, like, this pandemic really showed everyone that like, health isn't just a certain person issue when they have a dying crisis. It's an everyday struggle, you know? And COVID didn't stop any other disease. Like, people are still suffering to so many other causes. Only now we're seeing it because everyone's facing the same disease. We're all facing COVID. Whereas
Right.
in previous times, like, these immigrants are facing the same struggles as your neighbor or you know?
Yeah.
Yeah, I don't know. It's definitely is like, it's really hard to think about it.
It is. Yeah. And I feel like that's maybe one of the reasons why people tune it out so much, because it's really hard to think about it and um you know, like, think about how much suffering there is. And especially if you're like a more privileged person, it can be hard to come to terms with the fact that like the system that you live under does not treat others as equally. And I think that's why some people get so defensive when they're confronted with that reality, because it's like, well, that's not how it's like for me.
Yeah.
But there's a lot of other there's many other people who you know, do suffer in that way. And I think when you were talking about like your work at the ARC and the things that you've done to provide resources for people who really need help, just kind of digging a bit deeper into that, are there any organizations or resources you'd like to share for our audience that you'd like to boost?
For sure. All right. Here, I can grab a list real quick. Like, they're still in my Gmail. So the first one off the top of my head is Copal. They're like a newer agency down in St. Paul and Minneapolis. They're great people. They really cover all aspects, like not just health, but they offer immigration help. They help people open up businesses. They translate everything in Spanish for free. Like, Copal is an amazing, it's just really great agency. Acer also is a really good agency that's always there to help out anyone who needs it. And there's MN Lead as well, which once again, they kind of all interlocks with like this web of nonprofits trying to help each other out. Because like what's cool about it is like Hacer knows people in Copal and Copal knows people in Hacer, so they kind of toss people back over like, I don't know, but they know over there, so let me send you that. There's also Casa de Esperanza, really good. They actually focus on moms and single wives or people like that who really are the most ignored by the system. So they're really great. They helped me give a mom like access to a lawyer to draft up a will. She was dying of cancer and she reached out to us saying that I don't want my son to go back to his abusive father. Like, and but like as she was dying, she was thinking about this. She was so worried, like, how can I get this help? Because I can't afford these fees, you know? And then Casa de Esperanza helped her out. Well, they helped me out because I felt so powerless because I didn't know these systems. And it's like, it's not like a simple Google search away, but like, cool. Much less a lawyer who speaks Spanish. So, Casa de Esperanza, like, I really admire them for all the work they do. Let's see. There's also a girl in Mankato. She doesn't run an org. She's by herself, but her name is Guadalupe Quintero. She actually works at MSU, but she is so involved with the community down in the southern portion of Minnesota. Like, she will bend over backwards to give anyone any help that she can, whether that be finding her the right resources, her being a resource for herself. She's truly a woman that I admire. Like, she's so impressive. Like, it's almost crazy to think that somebody like that exists. Not only does she have a PhD, but she, among working in the school, she's constantly giving back to the community. Like, this woman doesn't stop. She's amazing. But once again, she shouldn't have to be doing all this. The system should be in place so people can just get help. But I digress. I feel there's one more that I'm missing. That's all that I can think of right now. But Clues, sorry. No, Clues, really great. They're actually all over the state of Minnesota. They also offer a lot of different programs, and they also fundraise for a lot of different causes too. So they have really good fundraisers. They just had one last week. They had asset dancers coming too, but all these funds are going to a good cause, and they don't charge anything for their services. So all these orgs can definitely help out anyone who needs any help. Really reach out to them, and if you can volunteer, really volunteer. Like, I know it sounds so small, and like maybe in high school people did it a lot more, but like just give a weekend, give a day. It means a lot to them, and it means a lot to the people that they're helping. So please browse them up online. Just give them a shot.
Yeah, no, thank you so much for giving such a great list of resources for the viewers. I'm sure it could really, really help someone out or multiple people. So, and volunteering is a fantastic idea. Really gives you like a sense of fulfillment too. So even if you're not doing it for any particular reason, it's great.
Yeah.
And
sorry. Oh, no, I just agree with you. My bad, bro.
No, it's okay. Now you guys can see like what an average Google Meet call between me and Ruben looks like. It's a lot of
oh, no, you want?
No, you don't.
Okay, you go. Okay.
But yeah, so I know that we only have about a minute and a half left, but if you could leave this conversation with one anecdote or message about this topic, what would you be? What would you want people to know about immigrant and refugee health?
Don't think big picture. As soon as we do that, like we lose so much of the like human value behind it. And that's what I did. Like, I'm calling myself out. I thought the only way I could help out was like doing big picture stuff. It's not. It can, even for those who know Spanish, if you just help out somebody and they ask you for help, like, don't be afraid to translate. Like, even if it's rough, like, dude, it doesn't matter. It means so close to them. And if you don't know Spanish or don't like have any ties to the Hispanic community at all, just, as it might sound corny, just walk outside, because we're everywhere, you know, like we're in every corner you turn. But don't think about it as like this major like international concept, because it is a major concept, but it affects everyday people, you know. And you might know somebody who's affected by these problems, you know. And I go back to the mom who called me like as she was dying, like, she's one of how many people, you know, one of how many. Don't think about this as a grand issue. Just think about it as my friend, my neighbor, my cousin's friend, anyone, anything. Just break it down to that. And I promise you, you're going to find it a lot more easier to get involved and help out. It really is what it comes down to.
What a great message. I would totally agree with that. And I think it would help a lot more people want to help out if they could hear that message. So I really hope that a lot of people heard that. Well, thank you so much, Ruben. This has been such a fantastic conversation. You're awesome. And I feel so honored to have been able to talk with you today. So thank you so much for coming. And for those watching, be sure to follow the CJL on Instagram and Facebook. Our next spotlight will be Wednesday of next week, September 29th. And thank you so much for tuning in and watching.
Raina, thank you very much for the opportunity. And thanks to the entire CJL for this. Y'all are doing amazing work, and I really appreciate everyone here.
Thanks, Ruben.
All good.